Kia ora koutou katoa. I'm going to talk to you now about something that you can all absolutely relate to, and that's food and nutrition. And more specifically around nutrition labelling and how nutrition labels shape the foods that we buy, the foods that we eat, and ultimately our health. There's a huge amount of research now that shows that the food that we eat is profoundly related to our health. There's lots of advice and guidelines around the kinds of foods we should be eating more of. So, for example, many dietary guidelines around the world encouraging us to eat lots more fruit and vegetables, like you can see in the picture here. You'll have heard the catchphrases, 5+ a day, eat the rainbow, 8+ a day, and so on, encouraging us to eat more of these healthy, unprocessed foods. But research and surveys show that we're not eating enough of these foods, but in contrast, what we are eating a huge amount of is packaged, ultra-processed foods, which have become incredibly common as our food supply has become more globalised and more commodified. So in parallel with those changes in our diets and the increases in ultra-processed foods, what we have seen is a huge rise in obesity rates and diet-related diseases like diabetes, cardiovascular disease and cancer. Here in New Zealand, we know that 2 in every 3 adults and 1 in every 3 of our children is overweight or obese, and that carries a huge amount of risk in terms of diet-related disease over a lifetime. So clearly something needs to be done. The question is what? The evidence, however, is there that there are a lot of levers that governments and society can pull that can actually effectively change eating habits for the better. So there's lots of evidence around things that you will have heard of, like sugar-sweetened drink taxes, restricting the availability of unhealthy foods in schools, and so on. But many governments around the world are really reluctant to implement those kinds of policies for fear of being seen to interfere with our individual choice. However, most countries around the world have adopted some form of nutrition labelling on packaged food. So, simply put, nutrition labelling is there to inform us of the nutritional content of foods, and the idea is that by providing that information we empower consumers to make healthier choices and ultimately improve their health. But the evidence around this as an intervention is pretty mixed. It relies very heavily on the individual, and so we were interested to know whether or not this policy, which is actually well accepted by governments and society, how effective it really is. So first up, we were really interested to know what effect, if any, different forms of nutrition labels have on the healthiness of the foods that we buy and ultimately the diets that we eat. Back between 2011 and 2013, I was part of a group that was advising the New Zealand government on the introduction of new front-of-pack nutrition labels. The idea behind front-of-pack nutrition labels is that they provide simple, at-a-glance information when you're in the supermarket that allows you to determine very quickly whether a food is healthy or not. So, in trying to make that decision, we decided to design a trial to see what impact different forms of nutrition labels would have, and we considered the labels that were being debated at the time. So up the top here, you can see the traffic light nutrition label, which is used really commonly in the UK and many other European countries. That was one option that was being discussed. And then down the bottom, you can see the Health Star Rating nutrition label, which at the time was in the process of being adopted by Australia. And in the bottom left, what you can see is the mandatory back-of-pack nutrition information panel, which is actually mandatory on all packaged foods in Australia and New Zealand. So what we did was we designed a smartphone randomised control trial where we randomised people across New Zealand to one of these 3 labels, and when they scanned the barcode of a packaged food, they were delivered the label that they were allocated to straight on their smartphone. So about 1,400 New Zealanders took part in this trial, and ultimately, after collecting millions and millions of units of shopping data, what we found was that neither the traffic light label nor the Health Star Rating label was any better than the nutrition information panel in terms of improving the healthiness of what we bought. But a smartphone trial is not the same as the real world, right? So in 2014, New Zealand went ahead and adopted the Health Star rating label. We have a trans-Tasman food system, so that wasn't surprising. New Zealand was keen to align with Australia. The Health Star rating system that you can see here allocates foods a star rating based on the overall healthiness of the product. And a food will get a star rating from 0.5 star to 5 stars, depending on how healthy it is. So here you can, down the bottom, you can see the Tim Tams have 0.5 star, and up the top, Weet Bix has 5 stars. So from 2014, we actually had a real-world kind of natural experiment going on in New Zealand where we could collect data and understand what effects these labels really do have on behaviour. So to do that, we use market research panel data. And so that's data that's collected on around about 2,500, from around about 2,500 households across New Zealand on every single product they bring into their home. So we collated that data from 2013, before the Health Star rating label was introduced, all the way through to 2019, when there was a formal review of the system, so that we could feed into that formal review. And what we found is that, first of all, the uptake of the label, which I'm not sure if I've mentioned, but it's actually a voluntary label, it's not mandatory. The uptake was really slow and really low by industry. In fact, even last year in 2023, it's still only on about 3 in 10 of every products in New Zealand. And perhaps unsurprisingly, it's mostly on the healthy ones. So industry do not want to put 0.5 star on their least healthy foods. But overall, what we found when we looked at this massive amount of data was, once again, the Health Star rating labels did not seem to influence the healthiness of what people were buying. But interestingly, we looked at the behaviour of industry, and we found that these labels actually do influence industry behaviour. So the products that adopted the Health Star rating had lower levels of sugar and salt than those that didn't. So they became healthier if they displayed a Health Star rating, and those effects were greatest for the least healthy foods. We were keen to see what impact this might have overall on population health. Once again, this is something that's very difficult to kind of understand in terms of what's the lifetime impact of an intervention like this. So we used dietary modelling, and you can see it illustrated really nicely here by Toby Morris. And essentially in modelling, you input a lot of data about population diets, our overall population age structure, diseases, hospitalizations, costs, and so on. And then you model a change in that diet. So we were able to model changes in salt and sugar intake based on what we found with our previous research, and then measure what impact that would potentially have on deaths, diseases, and costs to our health system. What we found overall is that, as you might expect, that our diets would improve slightly in terms of reductions in salt and sugar because of the reformulation effects, and that it would have modest effects in terms of improving health gains. The effects are pretty modest because it's voluntary, and it's only on the most healthy foods, which are least likely to be reformulated. But that said, the health gains that we saw were comparable to or in fact, they were greater than what you would expect for one-on-one dietary counselling or mass media campaigns promoting healthy eating. So modest, but still better than many other accepted interventions. So where does this leave us? What did it tell us? It told us that nutrition labelling is a step in the right direction, but that voluntary front-of-pack nutrition labels have very limited effect on consumer behaviour. They do, however, have an effect on industry behaviour, but to maximise the effect on population health, we really need to mandate a front-of-pack nutrition labelling system so that industry adopts it and puts it on all products, including the least healthy products. And in doing that, we will not just empower consumers to make better choices, but we will also incentivise the industry to create a healthier food supply by focusing their products on getting more stars. Thank you.